morning. I'm Veronique Roger from Mayo Clinic, Rochester, and I'm delighted to talk to you today about our paper that's coming out in the Mayo Clinic Proceedings entitled Acute Coronary Syndromes in the Community. In this paper, which is first authored by Sheila Manneman, our team of cardiovascular epidemiologists and statisticians asked the question, what has happened to heart attack between 2005 and 2010? And so we asked the question because there had been data from previous years showing that heart attack had started to decline. So the question was, are we seeing a decline in the most severe forms of heart attack, the one that we call myocardial infarction, that could be offset by an increase in the number of milder heart attacks? In other words, are we just seeing a change in the face of the disease, or are really all heart attacks declining? And so we set out to do the study to answer that question. And what we found, looking at the two types of heart attacks, or acute coronary syndromes, if you will, both myocardial infarction and unstable angina, that over these 5 years, which is not a very long period, we saw a decline in their occurrence or incidence of first event of about 38%, which is a large decline, particularly for such a short period of time. So these findings really demonstrated that what was happening is that all these entities that we call acute coronary syndrome, combination of the most severe form of heart attacks and the milder form that we call unstable angina, were all going down, which is a really good thing. It means that there are less people every year that are experiencing these events. As far as the survival, it remained the same. We didn't see any improvement in people living with that disease in terms of their outcome, their mortality, if you will, no reduction in mortality. However, in previous years, thanks largely to new management approaches for these entities, we had seen a major improvement in survival. So the fact that we didn't see any further improvement was not something overly surprising, because we had seen such an improvement in prior years. So, you know, these findings are important because they demonstrate that there's really a form of coronary disease which is gradually declining, which means that the way we care for cardiac patients is changing, and it's helpful to prepare the next generation of cardiologists. It's also helpful to identify for our patients approaches that they can take to further reduce the burden of cardiovascular disease.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.